So we're going to start with Melissa Carter, and she is from the Barton Child Law and Policy Center. And I would just ask her, we've been given this picture of child deaths in Georgia in the last year. So can you put this in some context for us of what might happen in other states or what we're required to do by federal law?
Thanks, Pat. Good afternoon, everyone. It's really my pleasure to be asked to join this panel. My reaction or my response to that question is really kind of twofold. There's a comment to be made about the process by which the agency is going about collecting this information and making it publicly available. And then there's the question about the substantive findings and how we compare nationally or to other states with respect to the actual number of children that we've just reported on and the kinds of illustrations that you've heard, particularly from Martha's presentation. So firstly, with respect to the process, the Federal Child Abuse Prevention and Treatment Act requires that all public child welfare agencies have in place procedures and policies for the public disclosure of information about cases of child abuse and neglect that result in a fatality. Georgia has in place laws and other mechanisms like the statewide child fatality review panel and the local child fatality review committees that actually satisfy that requirement. So what I would love to make you aware of is that actually, and give a lot of credit to Director Cagle and to the agency for taking this progressive approach to actually disclosing this information in this kind of public forum as a way to engage you with this information and share it and make sure that you accurately understand the nature of this kind of reporting. So in that way, I would say that Georgia is kind of ahead of the game in its comparison with other states. We're doing a lot of things by way of the public disclosure that we can be proud of and again, having this conversation and fueling this conversation. With respect to the substantive findings, the answer is a little less satisfactory. The findings across states with respect to the number of children who die as a result of maltreatment in any state. And that's because, as you heard Martha talk about in some detail, the case definitions that apply here, the reporting and the data collection rules and parameters that apply here vary in other states. And so we don't end up with the kind of apples to apples comparison that we really want. And it defies our ability to really reduce it to a number and to know how that number trends over time. It just all depends on the source of the information and the parameters that guide the collection of that information and the reporting of that information. So one source, for example, there's a child maltreatment report that's issued by the Federal Department of Health and Human Services every year. And their most recent report, which is actually in 2012, because we always have this retrospective look, in 2012, you would have, as you look at that report, it sort of indicates that Georgia's actually not that far out of line in terms of our rate of child maltreatment-related fatalities compared to the national rate. Georgia's was reported about 2.82 children in that rating, and the national rate was 2.20. And there were other states that were much greater outliers in that range. But that's just one report. Even the processes that we have here available in the state, of which we're considered to have really robust processes for looking at child fatalities, don't really lend themselves to being reconciled to a single number, which is what we keep asking for. What is that single number of children? And then how then does that reflect on the agency's responsibility for those children? Our child fatality review process, where we have the local child fatality review panel, and we have multidisciplinary committees that sit in each county that review all the children's deaths, is public health oriented, so it's population based. They review deaths of all children, so anyone under the age of 18 that dies as a result of a suspicious or unexpected death. And in 2012, that same sort of reporting period, that report for our child fatality review process reported that there were 83 children who died as a result of maltreatment. That same time last year, we were talking about the report from DFCS that reported 152 children who died. So those numbers all vary, and that's really just because of these case definitions. As you heard Martha talk about, DFCS is subject to this state law that imposes this broad scope of any child whose family has had history with the department, and that history can really range from a number of interventions, from a screen-out report all the way to the most intensive interventions that the state has. So it introduces a lot of variables, a lot of variation that, again, defies our ability to draw quick and easy comparisons, which is what we really want. In fact, this is so complicated on the national front that there was recently passed by Congress the Protect Our Kids Act, and that created a national commission. It's the commission to eliminate child abuse and neglect fatalities, and that commission has been convened partly with the purpose of developing a national strategy around understanding these child fatalities, coming to a common definition of what a child maltreatment-related fatality is, and devising strategies for prevention. But just in closing my comments, in our quest for having that single number and knowing how that compares over time, we can't overlook the fact that we actually have findings that we know are actionable. We know, regardless of information source or people involved, we know that children who are young are particularly vulnerable, particularly under the age of 2, and especially if they have special medical needs. We know that parents and unrelated caregivers are who present the greatest risk for commission of child fatalities. We know that things like substance abuse and domestic violence and economic stressors and social isolation present greater risk for children. We know that we're going to have to get all of these data sources together and have the ability for them to be integrated into a more comprehensive picture of child fatalities. And we know, lastly, that it's going to take all of us, that this is a community responsibility, not just a responsibility that falls to DFCS, that it's going to take all of us to create safe environments for children, and particularly that we need adults who are willing to act boldly on behalf of children so that we can prevent all of these, and we won't have to come back and convene year after year to have this kind of discussion.
Thank you very much for setting the standard on sticking to the time frame.